Imagine if the time you spent watching Netflix or playing video games could be one of the most productive parts of your day. This may just sound like a fantasy, but with neurofeedback, it may actually be possible. So what is neurofeedback? Before I get into that, I should define biofeedback. The Association for Applied Psychophysiology and Biofeedback defines biofeedback as a process that enables an individual to learn how to change physiological activity for the purposes of improving health and performance. In a biofeedback treatment, instruments are used to measure different physiological characteristics, such as heart rate, muscle activity, and body temperature. With these measurements, doctor and patient are able to work together to improve symptoms using the body's natural mechanisms. Neurofeedback is a type of biofeedback that measures brainwaves in order to help train patients with both psychological and physiological goals. There are differing theories about the best uses of neurofeedback, but some common uses are improving focus, increasing quality of sleep, stabilizing mood, reducing migraines, treating psychological disorders, improving athletic performance, and alleviating physical tension. All these issues stem from different parts of the brain, and it is extremely complicated to represent all of the neurological interactions that cause them. But it is possible to simplify the role of neurofeedback in their treatment. The most important part of neurofeedback is the different types of frequencies measured. Neuroscience researchers have been able to categorize brain frequencies into their corresponding neurophysiological effects, depending on the numerical value in hertz.
This graphic shows this concept by summarizing information from the Comprehensive Review on Neurofeedback System Design published in the Clinical Neuroscience Journal. Each classification of frequency has empirically derived associations with traits expressed. For example, delta waves are known to impact sleep, repair, complex problem solving, unawareness, and deep unconsciousness. There are positives and negatives associated with each class of brainwaves. The goal of neurofeedback is to find a balance that works for each person. Some frequencies are almost universally associated with certain symptoms. For example, high levels of beta frequencies are normally expressed in patients with high anxiety. However, the exact effects depend on the individual, so it is up to the trained expert to discover the ideal frequency for each patient.
So what does a typical treatment look like? In a neurofeedback session, the patient can select any media, like the movie Frozen. As the movie plays, the electrodes on their head measure the brain's activity and record any changes. The practitioner will determine the neural frequency type and range that has the most benefit for each treatment. This depends on the patient's symptoms, goals, and baseline activity. Sometimes it takes a few sessions to determine the ideal range. Once the program is set, the quality of the movie will be directly tied to the targeted brain activity. The practitioner and patient will have two separate screens. The therapist monitors the brainwaves as the patient watches their movie. The actual neurofeedback graphs are difficult to read, so I will provide a simplified version. As their brainwaves go out of the desired range, the movie grows lighter and smaller on the screen. The volume also decreases, making it harder to watch. When the brainwaves return to the target, the video and audio return to normal. This creates an unconscious connection between the media clarity and the intended range of an unrelated brain activity. At first, the association is weak, but after many sessions, the brain training is more effective. In fact, many patients stop experiencing notable changes to their content after they adjust to the neurofeedback. This process takes a few weeks or months, depending on the patient. But does this actually create lasting effects? There's some disagreement among experts, but a significant amount of credible research shows that neurofeedback is an effective treatment. One way to see this is neural imaging. Brain activity can be mapped with QEEG technology. This measures the brainwaves from specific locations and outlines where each level of activity is occurring. Over time, the brain activity in a neurofeedback patient will change. This graphic was created by the Drake Institute of Neurophysical Medicine to show this effect on one of their research participants. As you can see, there is a significant difference in beta activity before and after neurofeedback. There is also symptom-based evidence. In a study performed by the National Center for Biotechnology Information, researchers measured the effect of neurofeedback on attention control. The goal was to inhibit theta activity in the brain and increase beta activity. Participants were all told that they would be given the same treatment, and they all wore the same electrodes while they played the same game. Only half of the participants received neurofeedback training. After the course of a few weeks, the participants who used neurofeedback showed drastically improved ratios of beta to theta activity, and most importantly, showed better performance on attention-dependent tasks. Whether or not this method works for everyone, it is important to spread awareness for neurofeedback because most people don't know about it. If it is more widely known, it has the potential to help lots of people. Right now, most insurance companies don't cover it, but if it's a more widespread treatment, that could change. Increasing accessibility to effective treatments benefits everyone. Whether it's used to treat a serious condition or just to improve studying capabilities, neurofeedback could make everyone's life better.